How's it going? Dr. J here with another inspiring message of health. And today I'm going to be talking about your chronic lower back issues and how chiropractic care can help get you better. Not only am I going to be talking about the importance of chiropractic care, but I'm going to be talking about the science of how it works and how it can get you better. It's my personal opinion that anybody with a spine, which is everybody, should be getting under consistent chiropractic care, because not only is chiropractic great for acute and chronic pain issues, and it's been proven time and time again, but it's also great as being a proactive measure to your health rather than a reactive. So it's my hope today that I inspire you to take that proactive approach and find yourself a great chiropractor if you don't have one already. And I can make some great recommendations for that. And as always, if you really like this video, please like and subscribe to our YouTube channel. That way you never miss out on any of our upcoming videos. I release these every Wednesday in the morning PST time, so definitely subscribe. Anyway, watch this video all the way through. You're gonna love it, and stay tuned, because here we go. Okay, so when it comes to chronic lower back pain, acute lower back pain, and issues with the lower back, the number one thing that matters is posture. As a chiropractor, I pay special close attention to my patients and their posture. So a couple of things we look for is when we're looking at a person from the front, their head should be level and not tilted. Their shoulders should be level with their hips. And their legs should be straight and not internally or externally rotated. From the side, what we should see is that the head and neck are in a neutral position with the shoulders. The shoulders are back and not rounded forward like this. And the hips, the pelvis, are in a neutral position, and it lines up through the center of the knees all the way down through the center of the ankles. A big problem with the side posture is that most people come in rounded forward like this, which will always increase the amount of stress and pressure that people have in their lower backs. Okay, so when it comes to the spine, okay, it needs to be straight when looking at it from the front, as straight as possible. So you may have heard of the term scoliosis before. The reason why scoliosis is such a problem is that when you have any lateral deviation of the spine, it's going to cause stress on the nerve system, particularly the spinal cord and the nerve roots. And what many people don't understand is that those nerves are going to muscles, they're going to organs. And if you get enough pressure and stress on those nerves, if you get enough nerve irritation, it can begin to negatively impact organ function. So severe scoliosis can be life-threatening, literally crushing the organs on one side of a person's body, and it just causes many neurological problems. So that's why they have to do the big scoliosis surgery where they lay down the titanium rods. But if it's mild scoliosis, chiropractic could be the key to correcting it. And there's even special schools of thought and techniques that focus on correcting scoliosis in particular. One of them is called the Clear Institute, where they've come up with a very effective methodology that is non-surgical, and they've gotten awesome results with hundreds upon hundreds, if not thousands, of patients who suffer with scoliosis. Now, from the side, what we should see is the spine should have three curves. There should be about a 34 to 45 degree curve in the neck. There should be about a 34 to 45 degree curve in the mid-back, which is the opposite of this neck curve. The neck curve is called a lordotic curve. The thoracic region, the mid-back region of the spine, this is called a kyphotic curve. And the lower back should have a nice 34 to 45 degree curve that matches the neck. Now here's why. When you lose the curve in your lower back, it puts more stress and pressure on the vertebra and the disc, which were never meant to bear all that weight. Over time, that amount of stress and pressure on the disc can lead to disc herniation or a bulging disc, which I went over in my last video when I talked about the importance of decompression in conjunction with chiropractic care. So a loss of curve in the lower back is terrible for the lower back, because now whenever you do any activity, whether it's sitting, standing, walking, jogging, any kind of high impact type exercise, all that pressure and stress gets translated onto the lower back, which is now totally straight. So all that pressure and stress goes directly through the joints, and that's how you can end up with disc degenerative disease and all types of problems. Now, one of the things that we diagnose as chiropractors, the only thing we diagnose in fact, is called subluxation. And when it comes to chiropractic subluxation, the term subluxation is referring to the vertebra, or the bones in the back. And what a subluxation is, when a bone or several bones move out of their normal position in the spine, it causes neurological interference and literally interferes with the brain and the particular part of the body wherever these nerves travel to. So one of the most common nerves affected when it comes to chronic lower back issues is the sciatic nerve, which comes out of L4, L5, and the beginning of the sacrum. All these nerves branch together to form the largest nerve in your body, the sciatic nerve. So if you get enough pressure, enough neurological interference, enough nerve irritation, it can lead to chronic sciatica type symptoms, or acute sciatica type symptoms, where you can get pain literally all the way down your leg, even into your big toe. But what many people fail to understand is that nerve controls a lot of muscles, so it can lead to muscle weakness, where your muscle just doesn't endure as long, and you can end up with injuries like muscle pulls and things like that because of chronic pressure and stress. That same nerves have branches that come out and go into the colon, the reproductive organs, and the bladder. So to reiterate here, it's important to have these three curves in the spine. Very, very important. Now with the pelvis, sometimes what will happen is the pelvis will rotate forward. That's called anterior pelvic tilt, or it will rotate back. When it rotates forward, the lower back curve hyper arches. So you get more of a curve in the lower back. And when the pelvis is subluxated, rotated backwards, called posterior pelvic tilt, that leads to a loss of curve in the lower back. Now the other thing to keep in mind is what's very important with chronic lower back issues, and many times doctors fail to make the link, is whatever's happening in the neck can dramatically impact the lower back. So let's say somebody has a loss of curve in the neck and lots of forward head posture. Well, the rest of the body follows suit, so you get this rounding forward of your posture, which puts even more pressure and stress on the lower back, and eventually the lower back wears out and leads to chronic lower back issues, okay? Now there's a paper that I just want to introduce to you, and I'll post the link below, but this was published in the Journal of Manipulative and Physiological Therapeutics. It was written by Deed and Donald Harrison. They are the founders of CBP, which is Chiropractic Biophysics, which focuses on correcting the structure of the spine. This article right here has over 200 references, and it's just like a 26-page article with 260 some on references. That's incredible. And they talk about the importance of posture, and what they found is that when you look at the research, the overwhelming majority of research shows that when you have a loss of curvature in the spine, it leads to chronic back pain, particularly with the lower back. A loss of curve in the lower back leads to chronic lower back issues. It's very, very important to have curves on the spine. Just to use my finger as the example, do a close-up on this, okay? If you have a curve, your body can better adapt to stress. But when you lose the curve, the weight of your body, all the pressure and stress, whether you're exercising, sitting, or walking, bears directly on the bones and the discs themselves, which again were not designed to bear all that weight. So now they bear all this excess pressure, stress, and weight, all this abnormal stress and pressure, and it causes them to wear out faster over time. So here's what I want to do now. Let's take a look at some X-rays together, and then we'll do a recap, and I will actually show you some chiropractic adjustments and how phenomenal they work, okay? Okay, here we go. So I want to show you guys some X-rays of a normal lower back compared to an abnormal lower back. And so if you notice, this is a normal back. It's straight when you're looking at it from the back, and the pelvis is in alignment with the hips, which begin right there. So both the pelvis and the hips are in alignment, and the spine is straight. And so as a chiropractor, when I look at the spine, I want to see that it's straight as possible. What do you notice about this X-ray over here? Well, there's a 5.5 degree bend right here, and this particular person came in with chronic lower back pain, chronic, and the right pelvis is higher than the left-hand side. So anytime you have a lateral deviation in the spine or a bend in the spine, that's going to put a significant amount of stress and pressure on the spine. Let me just show you with the spinal model. So you can imagine that you have all these nerves that are coming out of here. Okay, so you have all these nerves that are coming out of these holes. These holes are actually called the foramen, which is Latin for hole. And so if you have that bend right there, okay, what is that doing to the spinal cord, which runs right down through the middle of the spine and these nerves? Well, it's going to increase the stress and pressure. So is it any wonder why this person right here is suffering with chronic lower back issues versus this person right here has no lower back pain whatsoever? Okay, so food for thought. Now let's take a look at the next set of films. So this is a comparison of two lower backs, okay? This is normal on the left, okay? This is abnormal on the right. So this person right here has about a 45 degree curve in their lower back. That's what it should look like. So if you remember when I talked a lot about posture, is you should have a normal, nice flowing curve through the lower back. What do you notice about this X-ray over here? The spine has totally flattened out. There's barely any curve, and it's only right here. The rest of it is flattened out. So when you have a loss of that curve in the lower back, you get more impact type force through the spine and the joints, which causes the joints to wear out faster. This is why people need corrective chiropractic care, because through life, like I said before, to reiterate, we suffer from traumas, car accidents, slips, falls, bad posture for years on end, especially if you're an office athlete where you're spending all this time in a seated position. Remember, you got to drive to work, and then you sit down at your desk 8 to 10 hours a day, 5 days a week. You've been doing that for decades, if not more, sometimes 25 years, 30 plus years, sitting at a desk, typing away, hunched over at a computer. And then what happens is you get back in your car where you do more sitting, where your posture is forward like that, even more pressure and stress on the lower back. And then over time, you suffer with a loss of curve. There's also birth trauma. This is trauma that's associated with the stress that birth causes. Even if it's a natural, healthy birth, there's still a tremendous amount of stress and pressure that takes place on the spine. This is why chiropractic is great for kids, even babies. Light force, not, obviously a kid or a child, a baby is going to get much less force with the adjustments compared to the adult, and it's completely safe. And there's thousands upon thousands of kids across the United States and in other countries as well that get regular chiropractic care, and they do just great. Okay, so you got birth trauma, and then you got all the stresses that happen. OSHA did a study, and I forget the year that this study came out, but they did a study on how often kids fall, and it's about 7,000 times by the time the kid has turned 11 years of age. It might have been 12, either 11 or 12, 7,000 falls. So when you hit the ground in a fall, you're hitting the ground at about 22 miles per hour, and all of that force and trauma gets translated through the spine, which can cause those nasty misalignments that we call subluxation. When you have a misalignment, to reiterate, when you have a misalignment in the spine, causing pressure and stress on the spinal cord and the nerves, causes neurological interference, we call that subluxation, or vertebral subluxation to be more specific. So this person over here, chronic lower back pain, numbness and tingling down their legs, and then the next thing I do as a chiropractor, I look at the disc spaces between the bones, and actually as you get down to the very bottom in here, there's some wear and tear on the disc. So this person right here has disc degenerative disease, and the closer the bones get together and the more wear and tear you get on the discs of the spine, that's even more pressure and stress on the nerves coming out of there. That's not a good thing. So what I did for this person is I put them on Corrective Chiropractic Care in conjunction with soft tissue work, physiotherapy, rehab work, and as well as spinal decompression. And you can check the video out that I filmed last week on the importance of spinal decompression and how it can help you with chronic lower back, acute lower back issues, how it can help to retract the disc of the spine back into a more normal position, and why we use that in our office. So let's go over how chiropractic care actually works. Let's go over the adjustment. I want to show you an adjustment and go over how it works to get our patients better, and why we get phenomenal results with patients with lower back issues. So I'm here with Cynthia, and Cynthia initially came in with chronic lower back pain issues. And so Cynthia, why don't you tell us about what initially brought you in? Why did you come in? We know that you're having lower back pain, but what was the final straw for you?
I wasn't able to do much of anything. Sitting, standing, bending was, by the end of the day, it was horrible. It wasn't great when I woke up, so it was just time to do something about it and see if I can get better quality of life and more energy and able to do normal things.
Okay. What were a few things that stand out in your mind that you weren't able to do because of the
Nice. Can I get you? Pretty much a lot of things, because if I was bending down too much during the day, which I'm always basically walking, I don't sit down very often, I just was in a lot of pain, and then I just ended up having to be down and be moody, and wasn't having a great time. My daughter wasn't having a great time either, so.
Okay,
yeah.
Got it. Okay, so how are you feeling now, and what are some things that you're able to do?
Big difference. Going hiking more, which is nice. A little more than I thought I could do the other day. More things outside, better moods,
Better moods?
Better moods for sure.
So tell us a little bit about that.
I'm real, short-tempered, real crabby at first, and then as soon as I start coming in on a regular basis, you can feel the difference and feeling better, and everything's feeling better, so of course my mood is better. Everything, yeah. Nice.
So, and then I remember you mentioned to me about something about your improvement with your digestion.
Yes.
What have you noticed?
I was in and out of the emergency room a few times last year or two, because my lower stomach, I couldn't figure out what it was. I did all these tests every time, like, we don't find anything wrong. So then when I came in here, then you explained all the things, what could affect, just your spine being out of line. The difference is amazing, yeah.
Wow.
Yeah.
So you haven't had any lower digestive issues since?
Nope.
Wow. So no gas, bloating, or
no cramps, no bending over, hurting. Yeah.
Okay.
That's been great.
Nice.
Yeah.
So what keeps you coming back? What would you say?
I can feel better and better every time. I love it. Yeah.
Awesome. Very cool.
Yep.
Well, you heard it here first. Get adjusted. Chiropractic is a good thing.
It's well worth it. Yeah.
All right. There you have it. So that's exactly how chiropractic works to get our patients better. If you don't have a chiropractor right now, what you can do is you can either comment below or personal message me or hit us up at thrivespineCenter@gmail.com, and I will refer you to a great chiropractor in your area, wherever you live in the United States. I even know chiropractors in other countries who actually take X-rays. A couple of things to look out for is, number one, you want to go to a chiropractor with a good amount of positive reviews. So I would go to the website, I would research the office on Google, and look at the reviews. Read some of them. We're one of the top rated offices in Folsom. We have over 50 5-star reviews, and we're getting more every single week. The other thing I would do is you want to go to a chiropractor who actually sits down with you, does a full-on consultation examination, and then they have some sort of objective test results. Now, the objective test we use in our office is digital X-ray. I take before pictures and I take after pictures. I take pre and post films because I want to show my patients that we get positive results. And the chiropractors I typically refer to are ones that have some type of an objective test result that they can do pre and post with you on. So fortunately, I'm networked with a lot of chiropractors who take X-rays and do that. And you also want to go to one that has an adaptive approach. No patient in our office gets the same adjustment. Everybody is different, and every body is different and requires a different adjustment. So you want to go to a well-versed chiropractor who's been doing it, who knows how to adapt their care based on that particular patient's physiological needs. So that's always a good chiropractor. And if you can call in and talk to the front desk person and be able to ask them questions pertaining to the chiropractor, like, do you guys take X-rays? Does the chiropractor do an examination? There are a lot of chiropractors where you just go in and they will just adjust you willy-nilly without doing any kind of assessment or objective testing on you. And unfortunately, I think that does our profession a disservice. The fortunate thing about chiropractic is it's really, really safe. The risks are very, very minimal, and the benefits are off the charts. Chiropractic is one of the #1 things you can go to for chronic back issues, including lower back pain, sciatica, neck pain, headaches, migraines, and the top 5 issues that we've been able to help a tremendous amount of people with is chronic neck pain, headaches, migraines, lower back issues, sciatica, and then other issues as well. And you know what the cool thing is? Not only are we able to get patients out of pain, but I've had patients tell me that they're sleeping better, that they have increased energy, that they have clarity of thought. Like, all these wonderful things happen as a result of just getting under chiropractic care. The patients made no other lifestyle changes, but all of a sudden they're sleeping better and they have better clarity of thought, they're less depressed, they have more energy. It's pretty awesome to see, and that's one of the reasons why I became a chiropractor. So hopefully this video finds you well. Hopefully it inspired you to find a chiropractor. Remember, you can always email me at thrivespinecenter@gmail.com. And if you like this video, please hit that like button and subscribe to our YouTube channel in the top upper right hand corner, okay? It's been my pleasure to be with you today. Stay tuned for the next video, which will be released next Wednesday morning PST time, all right? As always, this is Dr. J. It's Align to Thrive, and this marks our 5th video in this 5-video series on how to eliminate lower back pain through natural means. And stay tuned for our next video series. Have a great day, and I'll talk to you soon.